Good morning, Professor. Myself, Kishore Gudpalli, and my teammates are Shravya Muriki, Teja Namineni. This is Group 1. The group assignment is medical vocabularies, that is, Current Procedural Terminology. It is also known as CPT. These are all table of contents where we are going to explain in detail about our CPT assignment. Introduction to CPT. The current procedural terminology is a standardized coding system utilized in healthcare sector. It is published and maintained by American Medical Association, and it also provides a uniform language for reporting scientific, surgical, and diagnostic services. Publisher. The main publisher of CPT is the American Medical Association, also known as EAMA. Regarding the publisher, it is founded in 1847. The AMA is a main business enterprise for physicians in the United States, but nowadays all over the world is using AMA services. It is also accountable for growing and retaining CPT coding machine. The CPT is introduced and maintained through the AMA. The first introduced in the 1966 year, the CPT undergoes regular updates to mirror improvements in clinical services and technologies. As a distinct general for the electronic reporting of doctor and other healthcare expert services under the Health Insurance Portability and Accountability Act of 1996 (HIPAA). CPT codes are up to date yearly and effective to be used on Jan 1st of every 12 months. The purpose and use of CPT. Purpose: the CPT is a standard coding system for medical reporting or surgical and diagnostic techniques and services in the United States healthcare sector. Primary use of CPT is it facilitates accurate verbal exchange between healthcare vendors, payers, and regulatory groups. It is used for billing compensation, medical studies, and documentation of scientific, surgical, and diagnostic offerings. The essential in health record systems for correct documentation and reporting is also done by the CPT. The CPT it supports studies, quality checks, and healthcare analytics. And why is CPT important? As we already explained, it is a standardized communication technique for healthcare vendors. It provides common language for healthcare professionals, insurance providers, and regulatory bodies, facilitates billing and reimbursement. Accurate coding ensures that healthcare providers are compensated for the services they provided. The one more point is it supports medical research and documentation. Proper coding helps tracks healthcare trends, effectiveness of treatments, and public health data. Moreover, it improves healthcare analytics and quality control. Researchers use CPT coded data for clinical studies, patient care improvements, and healthcare audits. And where we use CPT? The locales are hospitals and clinics. In this sector, it ensures clear documentation of medical procedures for patient records. In insurance companies and payers, the CPT used for processing claims and determining coverage eligibility. In the government sector, the CPT is used like regulatory bodies for Medicare and medical use. CPT codes for adults and reimbursements validation. One more or one more thing is electronic health records. It is integrated into health informatics systems to maintain structured data for patient care. For example, imagine a patient undergoing surgery. Every step of surgical process from pre-operative assessment to post-operative care must be coded. If the wrong CPT code is used, it could lead to insurance claim denials, incorrect billing, or inaccurate medical records. The next slide is explained by my friend Shravya.
Organization and structure. The CPT code is organized by categorizing them into three important classes. Category 1, which is also called as numeric codes for clinical tactics and services. For example, 99213 is used for an office visit. And category 2, which is also called as performance tracking codes. Example 0001F, which is used for measuring blood pressure. And the last category is emerging era codes. Example 0123T for experimental approaches. The CPT code format is usually 5-digit numeric codes, that is example 99213 for an outpatient visit. These codes are updated yearly with the aid of AMA as said by my teammate Kishore. Example term usage, non-Hodgkin's lymphoma. Description: it is a blood cancer that impacts the lymphatic system. CPT used for this is, if the patient's receiving treatment for this, the CPT code might be 96413, which can be known as intravenous chemotherapy infusion. The CPT codes for this diagnosis and the treatment includes 88342 is also known as immunohistochemistry for tumor evaluation. 96413 for chemotherapy management and intravenous infusion. 99205, which is used for initial complete evaluation for a complicated circumstances. The applications of CPT are: the CPT device ensures consistent reporting of diagnostic and treatment services for conditions like non-Hodgkin's lymphoma. Accurate coding helps clinical selection, decision making, compensation, and further studies. This code is documented to invoice insurers for the administration of chemotherapy, assisting in accurate clinical record keeping for further use. Next, coming to challenges and ethical issues. The first one is coding errors and their impact. Upcoding, which is also said as use of the higher priced code for a less complicated procedure. This leads to fraudulent claims. Undercoding, which is also said as use of a cheaper code. This can lead to a loss of money for hospitals. The next is duplicating billing, which this may lead to insurance denial or audit. Regular training requirement. The coders must keep up with their annual CPT updates in order to not incur further penalties. Legal consequences will result under federal law if there is any error shown in the CPT code. Ethical coding responsibility. The coding has to be actual medical services done in order to prevent fraud. Patients rely on accurate documentation for long-term healthcare planning. And the next slides will be explained by my friend Teja.
Yes. This slide is explaining to future CPT and medical coding inventions. Developments in AI and automation. First one is coding solutions with the help of AI can automate code selection, reducing human fallibility. Integrations with electronic health records like that EHR make real-time coding and billing easier. Expansion of telemedicine codes. With the expansion of virtual healthcare, CPT codes now include telehealth consultations. Evaluation healthcare needs. With the advancement of gene therapy and personal medicine, new CPT codes will be required. Coming to next slide. This topic is involve the conclusion. CPT is vital medical vocabulary for healthcare operations, helping correct billing and efficient communicate. Its dependent layout and complete coding classes make it a vital tool for healthcare stakeholders. Understanding precise course along with the chemotherapy for non-Hodgkin's lymphoma demonstrates CPT's real-world utility. Understanding its position aids in correct and efficient healthcare delivery. Coming to the next slide, this topic is taken from these all references, and then thank you.
Thank you, Professor.
Professor.